Okay, we're live.
Okay. So, welcome everybody. For those that don't know me, my name is Dr. Ryan Polselli. I'm a fellowship-trained breast imaging radiologist. Most people call me Dr. P, Dr. Ryan. This is my first time on Facebook Live. It's a little out of my comfort zone, but I have a very important message, and I want to try to embrace the technology available to the modern doctor. So this is going to be the first part in a 5-part talk about the 5 most important things a woman should know about a mammogram. Today I'm going to start with number 5, and then I'll work backwards. Obviously, Hurricane Irma is on her way, so I'll probably have to discontinue the talks, and we'll resume once we know that everybody's safe. Our thoughts and prayers are going to be with anybody who's going to be affected by Hurricane Irma. But we'll pick up when that's all done. The idea originally came to me to do this when I began writing an article for a newspaper which I intend to deliver to media outlets and in the future next month for Breast Cancer Awareness Month. My original intention was to try and take some of the mystery out of the mammogram process. So normally a trip to the doctor, a patient goes in, say for a physical or something like that. They sit down, they have a long conversation with the doctor. When the visit's over, the patient goes home, they actually saw the doctor. When a patient gets a mammogram, that's not the case. They come in, they see the technologist, the radiologist, and it's not because we radiologists don't want to talk to the patients. It's just that we're here in front of our screen in a dim room like this where we have to be according to FDA regulations. We've got 20, sometimes 30,000 patients that we read in a year, and it's just by necessity that we don't end up having enough time to talk to the patients, and it's really not fair. So I figured at lunch I could do this talk and give patients kind of an inside glimpse of what goes on and try to take the mystery out of the whole thing. So let's see, I've sat down with a lot of patients recently and in front of the monitor to show them what their mammogram looked like, and a lot of them said, this is the first time I've ever seen my mammogram. And I was kind of shocked, taken back. I was like, well, that shouldn't be. It's your mammogram. You should know what it looks like and things about it. And so I figured that's a shame. So anyway, one of the things that has become important to me is giving back control to the patients. I think patients are being bumped around, unfortunately, because of the way the healthcare system has become, and it's become very difficult for them to actually feel that they're in control of their own healthcare. And so I want to try to get rid of some of that confusion today. Another thing that I think is part of the reason is that, and I'm not blaming the media, but I feel like they are a little bit out of touch with the whole screening process lately. I think there's a tone, and I've gotten this from a lot of feedback from patients saying to me that, well, I heard mammograms aren't important. Well, I couldn't be further from the truth. As a breast imaging radiologist, I see this stuff every day, and I wasn't originally going to do this, but I think that it's become pretty important. I got a letter this week from a patient of mine that I'm going to read here. There's no identifying patient information or anything in that, but it says, Dr. Polselli, you had known a breast biopsy on my wife a while back and had given us great care and assurance. I hope you could remember who we are. My wife had contacted you the last fall. She sent you a large file, everything that was going on, blah, blah. You recommended this, etc., etc. We are so thankful you had extended yourself in this way and put us at ease when everything was upside down. Unfortunately, I need to ask again for your assistance. We found out last Thursday that my wife's cancer has spread. We are told that she has something under one of her breasts, something in the sternum, lymph nodes in the pelvis, and a 1 centimeter mass in her left thigh. We are upside down again and hope that you could help us. Anyway, some other information, and if you could find time to help us, give us a call, blah, blah, blah. We'd greatly appreciate it. Thank you so much. The reason I'm reading this letter is because screening mammograms can stop this 100%. Early stage breast cancer, 100% cure rate, 99 point something now. late stage breast cancer down to like 30% cure. So I want to impress the importance, despite what you may be hearing in the media about screening mammograms. Men, like this, encourage your women to get the mammograms. Ladies, encourage your men to get prostate exams. They're uncomfortable for the both of us, but it's the way we need to take care of each other. Anyway, moving on. The reason I say this is I want you all to like this on Facebook, share it, get the message out. I think it's pretty important. But number 5 of the top 5 things that every woman should know about a mammogram is the relationship between deodorant and mammograms. So it recently came to my attention, and I didn't know this. I thought it was always known and understood, but a lot of patients think, because I think all women know that when you have a mammogram you have to get rid of deodorant. Well, a lot of women think that it has something to do with the sanitation of the machine, or the fact that they don't want deodorant on the paddles, or whatever it is. It has nothing to do with that. It has 100% to do with the fact that deodorant can look like breast cancer. We sanitize the machine after every patient, no matter what. It's always clean. We use Cavicide or something of that equivalent. I mean, this is strong stuff. There's like Lysol on steroids. There's no germs on the machine. We could care less about the deodorant causing that. The reason is, and I'll show you on the screen here in a little bit, is that deodorant has high density particles in it, well, antiperspirant in particular, some deodorants, some lotions, some powders. But these high density particles, like aluminum, don't allow the x-rays to go through. As a result, they can look like tiny specks on the mammogram, which is just like calcium. Let me give you an example. So this is a mammogram, and this is a case in point. This woman accidentally had deodorant left on her mammogram. And you can see right here, this is what deodorant looks like. And from a radiologist perspective, I know this is deodorant because she's been worked up. We had extra pictures. She had to come back, and we've proven that it was deodorant because we got a second picture. We wiped everything off, and this was not there. But this, right here, all this area could look just like calcium, and say, well, why is calcium a problem? Well, normally calcium's not a problem. We see it in the breast. It's usually due to benign causes. Parts of the breast calcify normally. This is not an issue. Occasionally, though, early breast cancer, which we call DCIS, that's breast cancer that's still within the duct. You can't see it here. The ducts are invisible, but there are ducts in the breast here. And when cancer is early, it starts dividing, the cells start dividing very rapidly, very quickly, and they die because they outstrip their blood supply. When they die, they leave behind dead cell debris, and that dead cell debris calcifies. It's the body's way of cleaning it up, and unfortunately, it looks identical to this. Cancer does occur up in this area of the breast too, so we're left with this dilemma, which is why we tell every woman, make sure you remove your deodorant. We don't care about the machine cleanliness. We're sterilizing that anyway, but I just wanted patients to know, because we get asked that question a lot. What is the importance? And a lot of people think that it has to do with the sterilization of machines. So, how much time do we have?
A couple minutes.
All right. So, basically, that's one of the top 5 reasons, or one of the top 5 things I think you should know about a mammogram. It's actually one of the more fun ones because it's harmless. And when Hurricane Irma is done and we come back, we'll talk about the other 4. Are there any questions? Anybody? No questions?
No questions so far, but you can ask questions while
Okay.
we have Dr. Ryan live for just a little bit. We'll keep it running for another minute longer.
So anyway, please like this session, like my posts, share this, help me get the word out. Hopefully, I get some positive feedback and this is a success. I'll do more of this in the future, a little 5-10 minute talk kind of thing on lunchtime when I can actually, put a face in front of patients, so to speak. So, all right, well, that's it. We'll see you next time. Thank you.